Hey everyone, welcome back to the channel. Today's topic is amoebiasis. Okay, so we will see the drugs which are used for this amoebiasis, anti-amoebic drugs. So this is one of the protozoan disease. We will also see the other protozoan diseases like Giardia, Trichomonas vaginalis, then malaria, rest all in different videos. Today we'll be seeing about amoebiasis. Okay, so what are the drugs used for this anti-amoebic drugs? We have two types of amoebiasis. One is tissue amoebiasitis and luminal amoebicides. Okay, first we will go through the tissue one. Okay, we have two types. One is intestinal plus extraintestinal amoebiasis and only extraintestinal amoebiasis. In only this extraintestinal means it occurs in hepatic, means liver. Okay, chloroquine used in hepatic amoebiasis. Then intestinal and extraintestinal amoebiasis, we have two types, nitroimidazoles and alkaloids. Under nitroimidazoles, we have metronidazole, tinidazoles, secnidazole, ornidazole, satronidazole. Okay, mainly nidazoles. Okay, this the name nidazoles is coming. Then alkaloids, we have amantine, dihydroamantine. Next is luminal amoebicides. It is categorized into three. What is amides, 8-hydroxyquinolones, antibiotics. Amides, it is dilozanide furoate. You will pronounce it like that. Dilozanide furoate. Then next is nitazoxanide. Next, under 8-hydroquinolones, we have quinidochlor and iodoquinol. Under antibiotics, we have tetracycline, paromomycin. Okay, paromomycin is the oral aminoglycoside and it is not absorbed well. Then under 8-hydroxyquinolones, quinidochlor, the other name is idochlorhydroxyquin. Okay. We are not going to see in details about this, but there is some points to remember about this dilozanide furoate. That is, it is an anti-amoebic drug which is used as a luminal amoebicides. It's an amide. Okay, it kills the trophozoite so that no cyst will be formed. Then it is used along with metronidazole and it can be used alone in mild cases and asymptomatic cyst carrier. Meaning carriers, okay, we can use this. Asymptomatic. What do you mean by carriers? Carrier means they have the potential risk, like they are asymptomatic. There is no clinical presentation, but they have the infectious agent within them which they spread to different organisms. Next, coming to nitroimidazoles, we will see metronidazole in detail. That is available as oral, IV, topical. Tinidazoles, oral, IV, these three oral. Tinidazole, what is the advantage? It is longer duration of action and it is better tolerable than the metronidazole. What are the uses of tinidazole? First is amoebiasis. That is the main topic we are seeing here. 2 mg once daily for 3 days. Trichomoniasis, 2 mg, trichomoniasis and giardiasis, both 2 mg stat or 6 mg once daily for 7 days, 1 week. Anaerobic infections like H. pylori infections and prophylaxis of the colorectal surgery. So these are the different uses of tinidazoles. Okay. Next is alkaloids, amantine. Amantine that inhibits the protein synthesis. Before that, we will see the mechanism of action of this nitroimidazoles when we will be reading about this metronidazole in detail. Amantine. Amantine inhibits the protein synthesis. It kills only trophozoite, not the cyst. It is injectable and the most common side effect is vomiting. It has beta test, it's an alkaloid, it has beta test and oral intake. And what are the side effects? There is a mnemonic amantine and then side effects comes as the name amantine. Emesis, muscle weakness, ECG changes. What is ECG changes seen here? T wave inversion and PR interval prolongation. Then tachycardia, itching, nausea, and another E for ecchymos means some lesions. Okay. So another alkaloid is dihydroamidine. So these are two types of alkaloids, and these are the nitroimidazoles. Now next, coming to the treatment of amoebiasis. We have a symptomatic carrier, then we will be using this one, amide one. Okay, what are those? Dilozanide furoate, that is tablet 500 mg TDS for 10 days. Or else we can use idoquinolone and paromomycin. In case of intestinal amoebiasis, like amoebic dysentery or diarrhea, we can use metronidazole or tinidazole plus one of the luminal agent, okay, like dilozanide furoate, that is 500 mg TDS for 7 days. And this helps in eradicating the cyst. It kills the trophozoite directly, so there will be no cyst. In severe amoebic dysentery or extraintestinal amoebiasis, this same is used, like tab, metronidazole 400 mg TDS or tinidazole along with one of the luminal agent. Then hepatic amoebiasis means extraintestinal. We saw chloroquine. Chloroquine is added, okay, because they will destruct the liver forms, okay. And here what metronidazole is used, 600 to 800 mg TDS for 10 days. Along with this tinidazole and dilozanide furoate is used. Then treatment of giardiasis. Giardiasis is caused by Giardia lamblia. We will see that in microbiology in details. Then what is the drug of choice? It is metronidazole oral, that is 200 mg TDS for 7 days. What are the other drugs that we can use instead of metronidazole? It can be tinidazole, nitazoxanide, then quinidochlor and paromomycin. These are the other drugs that can be used for the treatment of the giardiasis, okay, instead of metronidazole. But the drug of choice is metronidazole. Then the next is trichomoniasis. Trichomoniasis is caused by Trichomonas vaginalis. What is the drug of choice? It is metronidazole, which is used as oral, okay. And here it is 400 mg TDS for 7 days. Both the sex partners are treated simultaneously. What are the other drugs that can be used? One is tinidazole, or we can go for intravaginal preparations. So what are those intravaginal preparations of this Trichomonas vaginalis? We use indoquinol, quinidochlor, chlortriazole, hamycin, natamycin, povidone iodine. These are used in different for a different duration, like 1 to 2 weeks or 3 to 4 weeks. That's not important for now, but they are used as different direction. How they are used? They're inserted intravaginal at the night time, bedtime, okay. So this is how the intravaginal preparations is done in case of Trichomonas vaginalis. This was all about the introduction or the various drugs that we use in amoebiasis. Next, we will see in detail about the metronidazole.